So right now we're just gonna clean his skin off just to remove any sunscreens or oils or anything like that. And today we're gonna do a BBL treatment for acne. I'm just gonna put the protective eye shields on. So the patient will usually still see a bright flash, which can be a little startling even though they have their eyes closed and they've got the little shields on. Ultrasonic gel. This is just to help protect the skin. And today we're going to do a BBL treatment for acne. So this will help kill the bacteria in any active, pimple, and then help just smooth out the color of the skin from any old acne. On a man, we typically don't ever treat any area where they have facial hair, so we're gonna stay just north of the beard area. Okay, so Carmine, I'll count to 3, and then you'll feel the warmth of the pulse and you'll see the flash. So 1, 2, 3. How's that?
Fine.
Okay, so now we just keep.
That was hot.
That was, yeah, some spots make it warm. Sometimes closer, to the eye, it gets a little more zappy.
Yeah.
So anytime that you're treating over a target like an active pimple or a brown spot or a red vein, the patient may feel that more than an area that doesn't have any kind of a spot or a pimple, just because the lesion itself is going to be absorbing more heat. Okay.
So this is the second pass?
This is the second pass. And then after this pass, I'm going to put on a different adapter, and we're going to go over just the individual active pimples. It's 3 stacked pulses of light, and it's going through a filter that is a blue light which targets the bacteria in the pimple. So the flash of the blue light is killing the bacteria in each little pimple.
So now you're targeting the individual
pimple.
pimples?
So there's one right here. And even ones that maybe have kind of run their course, but there's still a little bit of a shadow on the skin of where an old pimple maybe was. This can help, the color of where the pimple was go away a little faster.
So you can do a treatment on the face or on the neck area as well?
Correct. Basically anywhere that there's a pimple. Okay?
So you said this is another setting, so what does that mean?
This is just a different filter. So one filter goes after the bacteria. This one's going to go after the redness or the inflammation that a pimple can cause on the skin. And then the other filter goes after the brown, that sometimes that shadowing that the pimple can leave on the skin. Just wipe off the gel. This is just called phytocorrective gel. It's just kind of a soothing gel that we put on after any kind of BBL treatment just to help soothe the skin. And then I'm going to put some sunscreen on him, a 30.
So how does that feel? Is that kind of cooling on your face?
I actually just feel pretty good.
It just helps kind of cool the skin off.
Yeah.
I'm just going to put a little sunscreen. This is a SPF of 30. So what we just finished was a BBL treatment for acne, which is broadband light, and it will treat any bacteria and any active pimple and help reduce the inflammation and redness, any cystic pimples, just by the use of the broadband light.